Hi, I'm Ken Pollock. I'm the Transit Director. As you know, the COVID-19 pandemic has changed our lives in more ways than we could possibly imagine. One of those is how we can continue to work and keep our families and ourselves and our passengers safe. At Bay Transit, we've done as many things as possible to keep you safe. If you look on the buses, you can see all the additions that we've made to try and help you keep safe. We are also offering a training today on employee protections in the workplace. And I'm pleased to introduce Alan Slade, our safety manager, who's going to continue with the training. Take it away, Alan.
Okay, thank you, Ken. I appreciate your support. This is a very important form of training, and I hope you'll pay attention. The person facilitating the training will take questions at the end, and then we have a couple other places you can go to get some answers. Today's training has been created by the Virginia Department of Labor and Industry, and it is infectious disease prevention, SARS-CoV-2 virus that causes COVID-19. And this is created by the Virginia Occupational Safety and Health people. This training and these standards exist to help prevent the spread of the COVID virus. It applies to every place of employment within the jurisdiction of the Virginia Occupational Safety and Health Program, and it's based on exposure risk levels, based on hazards present or job tasks, and defined as very high, medium, and lower. Training needs to be done within 30 days, and we're going to accomplish that at Bay Transit. So, protecting our employees. These are actions that Bay Transit needs to take under Virginia regulations and actions that we have been taking well in advance of these standards. And so these are the big categories: social distancing, the 6 feet or more, self-monitoring, what we do through the Bay Transit Health Check, posting various signs, offering disposable face masks, and we do that for our employees and for our bus passengers, other PPE, personal protective equipment, clean and disinfect training, and prohibit infected workers from returning to the workplace. Okay, lower risk employees do not require contact with others inside 6 feet. There's nothing in the job that gives them increased risk through contact, or we can achieve minimal occupational contact. Medium risk requires more than minimal occupational contact inside 6 feet. That includes employees such as waiters, grocery store workers, agricultural workers, construction workers, domestic service workers, hairdressers, fitness instructors, workers in poultry and meat processing facilities, manufacturing workers, and healthcare workers in settings without known or suspected sources of COVID-19. High risk, high potential for employee exposure inside 6 feet, hospital workers, first responders, medical transport providers, mortuary services workers, medical and dental staff, non-medical support staff, long-term facility staff, home health care workers, etc. And most jobs in Bay Transit, including driver jobs, would be classified as high risk. That doesn't mean that you are at a high risk of getting COVID, but that the situation requires extra precautions and extra training. Very high risk, high potential for employee exposure inside 6 feet, performing specific medical procedures, post-mortems, or laboratory procedures with specimens from an individual. And we do not have that here at Bay Transit. Determining exposure risk levels. A lot of time and thought has gone into this, both at Bay Aging, headed up by our human resources people, and then here at Bay Transit. I've been involved in this, obviously, but so have all of the managers and Ken Pollock, and supervisors have been consulted as well. So for employees who are classified as very high, or medium, training is required. We have to talk about characteristics and method of the spread of the virus. And basically, there are several known ways the virus spreads. It spreads through aerosol contact, someone breathing, coughing, sneezing, and droplets come out, and someone else breathes in those droplets. And it can also come through surface contact. So someone has some level of virus on their hands, and they touch something, and then a little later someone else comes by and touches the same thing. The risk factors associated with COVID, and no one is immune from the risk of COVID, but people who are older seem to have a greater impact if they do catch COVID. And then people with a number of medical issues, especially respiratory issues and heart issues. We want everyone to be aware of the possibility of transmission, and then we want to have safe and health work practices to protect ourselves and to protect our passengers, and to protect our families and others that we come into contact with. There's a requirement for this analysis of PPE, and then also a requirement to provide it. There are legal protections to prevent discrimination on the basis of someone raising an issue related to COVID. And then we as Bay Transit and Bay Aging as a whole are required to have an infectious disease preparedness and response plan. And Bay Transit and Bay Aging have had those in place from early on. We started working back in March, and we continue to expand and refine our plans. Other requirements to protect our workforce are expanded sick leave, and the offering of telework when a job allows it, staggered shifts to minimize the cross contact between workers as much as possible. The Families First Coronavirus Response Act, which includes things such as a more flexible use of sick leave or family medical leave to prevent the spread of COVID. We're responsible to have a policy around self-reporting and monitoring, and all of you at Bay Transit have been doing this through the Bay Transit Health Check. Reporting positive test results. We are obligated to report those to the Virginia Department of Health, and under certain circumstances to the Virginia Department of Labor and Industry. And the notification of positive tests to all exposed employees. Obviously, we have to do this confidentially, but if and when this were to happen, we would inform people who have been exposed without revealing necessarily the individual who's been the source. And then return to work procedures. What are the things that need to be evident, need to be shown when an employee has been exposed when they return to work? And we've got our procedures on how long you have to go, the availability if you have two negative tests that show that you do not have the virus, and so forth. And there are many more details around that. Okay, the PPE assessment, the personal protective equipment. It's the responsibility of Bay Transit to assess the hazards, to select the appropriate PPE, and then to make sure that that our employees use it and clean it and store it and fit it appropriately. And so we've looked at the various job tasks and evaluated tasks that have no hazards, tasks with hazards present, and then tasks where the hazards may not always be present, but they're likely to be there. And then we have to figure out what PPE is needed in those situations and ensure their employees have access to it. And so for us, the key hazards for a bus driver are assisting passengers, loading wheelchairs, helping with packages. That's where at times our drivers will have to get up close and spend a fair amount of time, several minutes, possibly 10 or 15 minutes, assisting a passenger. And so we have to make sure that you are prepared for that. So for our assessment, we inform affected employees of the process. We review the data. We conduct a walkthrough survey. We determine the hazard level. We determine controls to protect against COVID-19. And we make documents accessible, and we reassess the workplace as necessary by identifying and evaluating. The controls to protect against COVID-19, to use some of the fancy terms, they're engineering controls where we have a physical barrier to protect employees. And so schedulers and dispatchers have the walls of their offices and the doors. Bus drivers have the shield between them and the passengers to protect them. Those are engineering controls, and we have others as well. Administrative controls are the standards that we have, the behavior that we expect our employees to engage in. And so cleaning common areas, cleaning and disinfecting common areas is an example of an administrative control. And then use of PPE is also, because it's not enough to give it to people, they actually have to use it. So that's also an administrative control. And we'll talk more about the specifics at Bay Transit in just a minute here. Okay, so we have been doing this and continue to do this. A variety of forms are used to do a hazard assessment. And these are consolidated by Medina and the Human Resources Group at Bay Aging. So let's talk about some of the actions that we expect you to take and that we know you have been taking. Social distancing, here with the X, we have people who, they're wearing masks, but they're within 6 feet and they're shaking hands, and we expect you to stay more than 6 feet away and no personal contact, so no shaking of hands. If you want to, do the high five that misses or anything else, that's great. Physical distancing requirements, announcements, signage, or visual cues. And so we have signs, for example, on our buses. And we'll talk about that in a few minutes. Decreased work site density. We've changed the scheduling for dispatchers and schedulers so that there aren't as many of them, and hopefully they're able to stay apart better. For our drivers, for example, we ask that you do not spend extra time in the driver's lounge. You know, if you need to get to work early, which is a good thing, you might want to hang out in your car or stay outside so that when you come in, you start your shift, you grab the materials you need, your tablet, keys, whatever else, and then head right on out to the bus. And then controlled access, we do not allow the public into our areas. And as always, we have, you know, the security to required. You know, you have to buzz into the building, for example. Common areas, physical distancing. We have signs posted. We talk about physical distancing. We have information on washing and hand sanitizing and cleaning and disinfecting of shared surfaces. So cleaning and disinfecting high-touch areas, that's key to what we do on the buses and in the offices. And all of us have that responsibility, depending on what your job is. You're going to be regularly cleaning and disinfecting something. There's information here at this EPA.gov website on disinfectants to use against the COVID virus, and we ensure that the disinfectants we give you are effective or on this list. Okay, so we expect you to wear a face mask, and we expect it to be worn properly. So it's covering your mouth and your nose, goes all the way from your nose to your chin. And then best practice is when you put it on or take it off, you do it by the loops. You don't grab by the body of the mask, but you put it on, you know, with the loops. Okay, and we expect you to wear this depending on your job, but basically whenever you're sharing a space with another person, or you're going through a common space. So maybe you have to go to the copier or the restroom. There's no one else around, but you have to wear a mask anyway because you're going through a common space. Okay, our infectious disease preparedness and response plan. We have to talk about very high and high risks. And we have more than 11 employees, so we also have to consider the people at medium risk. We have to talk about who's responsible for implementing it, and we have to have some type of a guidance document. This plan shall contain names and titles of the person or people responsible for administering the plan, provide for employee involvement, and discuss exposure risk level. It's going to have where, how, and what sources we are aware of that we're working to control, the engineering controls, the administrative controls, work practices, and the PPE that we're using to control the risks. The plan shall contain contingency plans for outbreaks, and our plan does have all of these items. Discusses employee absenteeism, control measures if there is an outbreak, how to handle the reduced workforce, and supply chain interruptions, especially for PPE. Plan shall contain infection prevention actions that we require, hand washing, and for us that includes hand sanitizing because as a driver you're not going to have access to a sink usually. Housekeeping and visitor education. The plan talks about identification and isolation, identifying people who are at risk and appropriately isolating them, reporting when they're experiencing symptoms of COVID-19. And once again, you do that through the daily health check, and then what to do with subcontractors. Our plan talks about primarily CDC guidelines because they were available first, and that's acceptable, or Commonwealth of Virginia guidance documents. And we have information on mandatory Virginia executive orders that apply, especially to transit. Okay, let's look at some Bay Transit specific information. This is the notice that should be posted on all of our buses. So you're probably familiar with it. All passengers and drivers must wear a face mask. Masks are required for everyone on public transportation, ages 10 and up. And this is by order of the governor. It was effective May 29th of this year, 2020. If you're sick, don't ride the bus. No fever of 100.4 or higher, no chills, coughing, sore throat, or shortness of breath. And whenever a passenger schedules a ride with Bay Transit, we ask about these symptoms. And if they have the symptoms, we do not schedule the ride. We ask them to go find another way to get the care they need. Keep your distance. Stay 6 feet away from the driver. Do not pay fare. We're giving up money to help protect our drivers and other passengers. Stay 6 feet away from other passengers. This is why we have seats marked off. Our passengers either will have a 6 feet of distance or an engineering control, a physical barrier between them and other passengers. And this is all designed to help keep our drivers and passengers safe. Here's some information on disinfecting and usage of gloves. And you've seen this before. It's been posted going back to March. So disinfect your bus. Spray the disinfectant, then wipe with a paper towel. During the pre-trip, you need to spray and wipe all touch points, handrails, handholds on seat backs, and driver controls. Spray and wipe all seating areas. Then frequently during your run, spray and wipe handrails and handholds on seat backs. Those are the most frequently used touch points. And so if you have a layover, go ahead and do a quick spray of those. If a passenger coughs often or looks feverish, we don't mean someone who has the dry cough, they just passed through a little cloud of pollen or whatever. You know when someone has a cough related to some type of respiratory illness. But if a passenger coughs often or looks feverish, after the passenger gets off the bus, you must glove up. Okay, this is a high-risk situation. Spray and wipe the row of seats where the passenger sat. Spray the seat back immediately in front of where the passenger sat. Spray and wipe all handrails and handholds on all seat backs, including at the door. Spray those handholds as well. That's very important. As soon as they get off, secure the bus and wipe down the area that this passenger probably had contact with. If you have a break scheduled for disinfecting, do the same procedure that you do during the pre-trip. Spray and wipe all touch points, handrails, hand grabs on seat backs, and driver controls. Spray and wipe all seating areas. If you have that scheduled break for disinfecting, please do that. During your post-trip, you should, as you're cleaning up the bus, doing your paperwork, doing the check of the mechanicals in the post-trip, spray and wipe all touch points, just like you do during the pre-trip. Spray and wipe the handrails, handholds on seat backs, and driver controls. Spray and wipe all seating areas. Use of gloves. Use disposable gloves as much as practical. You must use gloves to disinfect after a passenger coughs often or looks feverish. You must use gloves then. Consider using gloves when you load wheelchairs or when you help a passenger with packages. There should be more than enough disposable gloves available. If not, tell your supervisor. I encourage you to bring a minimum of 3 pairs with you. I use a pair during the pre-trip, okay? You may or may not do that, but you need to have them available in the event that you have a passenger who's exhibiting symptoms. And so make sure that you have gloves with you on the bus. If you don't use them all, fine, you can leave the spares on the bus. Okay, that concludes our presentation. If you have any questions at any time, you can ask your supervisor, you can ask me as safety manager, or any other Bay Transit manager, any questions about COVID, what we're doing, what our plans are to help protect you and other passengers. Also, you should be in this meeting, I hope, with your supervisor or someone else who's knowledgeable about what we're doing. And so there'll be a chance to ask them questions in just a minute here. There's some websites available to give you more information, and please feel free to go to those as well. So thank you very much. Appreciate your attention, and I'll turn it over to the person who's helping with this training.